You're busy, you've got a decent practice, but nobody wants to be decent. You want to be great, and you want to have a great practice. So how did the most productive, profitable dentist in the nation balance real life, work, and profits, and somehow make it all seem fun? Well, it comes down to simple, everyday practices. So grab a lunch, join us as we chat with top clinicians and influencers to discover their formula for uncommon success. Are you ready? Then it's time to explore everyday practices with Vicki McManus-Peterson and Dr. Chad Johnson.
Chad, I'm super stoked today.
I am too.
Okay, first of all, we're at PDA workshop, which is great.
Yeah.
And we're here with two of our favorite people.
That's right.
Repeat offenders, longtime
Absolutely.
friends, graduates, alumni, clients,
All the above, right?
friends.
Yeah. And I just met these guys here in Fort Worth. So
Yeah. So we're happy to have Dr. Ron Miller and Dr. Ryan Oakley, the legendary
Uh-oh.
Prada shoe-wearing Ryan Oakley. Really? They're
Gucci.
who? Gucci.
Yeah, sorry.
See, now this is why you need to be on here. Why? Let's just start there. You're known for a lot of things,
Uh-oh.
but I most love you for your shoes.
Thank you.
And it's something every day I know you give conscious thought to. So what is it with the shoe?
I like shoes.
I do.
Yeah. I've liked them for a long time. I don't know when this necessarily switch happened.
Was it a high school thing?
No, so I went to Del Rio High School, and the everyday uniform in Del Rio High School was the Tommy Hilfiger shirt, the Gerbeau jeans, and lace-up Red Wings.
Okay.
Nice.
So I rocked that look for a little bit. And then sophomore year in college, came Abercrombie and Fitch.
Yes.
And then
Did you wear the cologne?
oh yeah, man. Absolutely.
Yeah. That stuff is pungent. You walk past their store and it's like, well, I'm wearing it now.
Yes.
Yeah.
Okay, for those of
But
you listening in, there is a point to this meandering. Because
Gotcha.
you're on podcast. You can't see how put together these guys are. But I think how you dress, how you put yourself together, you and Ron rock these fabulous hairstyles. I mean, you're meticulous in these things. These details matter to you. So what is it with the shoe?
I don't know. I just like shoes.
But you like Gucci. You like
I
Prada.
do. I do.
He likes expensive.
I
So,
do.
what do
He
you
likes
feel like
expensive
that
things.
brings to your persona in how people perceive you in your office? Do you feel like that, or is it just like, I
Like
don't
it's
care,
not
right or
cowboy
wrong?
boots. This is specific.
Yeah. Well, I mean, I wear scrubs and tennis shoes at the office.
Yeah.
Okay.
This is not how I'm dressed
Oh,
normally.
Not anymore.
So
He abandoned it.
yeah, I kind of abandoned the
Gotcha.
I used to wear slacks and a button up to work.
Oh.
And then
How long ago did that switch?
Gosh, I've been wearing scrubs for a while now.
At least 3 years.
Yeah.
Oh.
When
3 or
Lindsay
4
started?
years,
Well, for the listeners, why don't you start too by both of you sharing? Ron, we'll start with you. Like, how long have you been practicing?
Out of dental school, 10 years. Working with Ryan, 8 years.
Okay.
And that's when I started PDA. Did my first PDA not long after I started working with Ryan.
So your vintage 2008.
2008.
Rock the recession.
2008. Yes. Well, it didn't hurt me.
Right. Yeah, everything was up for you.
Are you a Texas guy to begin with?
Yeah, raised in Humboldt, Texas, basically Houston, and went to dental school in Houston, went to A&M. Born in Pennsylvania, but got to Texas as soon as I could.
Right on, the Republic.
Yes.
Awesome. And Ryan, how long have you been practicing?
I graduated dental school in 2004. I worked for, I mean, corporate's not like corporate of 15 years ago isn't like corporate dentistry today.
Yeah.
But I worked for a corporate style outfit for about a year and a half.
Right.
And then I
Got
bought
skills up.
Then I bought the practice that is still the practice that Ron and I own right after that. So that was in 2005.
Perfect.
So I'm, I guess, a veteran
Yeah.
nowadays. I have experience
Over
sort
the
of.
past decade,
Mhm.
how have you noticed that that corporate and DSO, the connotations to them and whatnot has changed, and not necessarily for the better or worse, but for better and worse?
Yeah. When I got out of dental school, corporate dentistry existed.
Yeah.
It just existed more of like regional areas where it was one person who owned multiple practices, right? And it sort of, that's where it got kind of a negative clinic, connotation to it. And nowadays it's more big companies, run by MBAs,
Yes.
not just by someone else. But no, and I don't necessarily, I don't have anything against it. I think it's perfectly.
It serves
I
its
think it. Yeah.
Yeah.
I mean,
So what's the dream that you and Ron have together? I know you've got your brand new associate,
Mhm.
1 month, and you're here at PDA. What's the dream? What are you guys building?
a good general dentist practice with one-stop shop. So I've been doing implants for 6 years.
Wow. Yeah.
And just want to be able to get into bigger cases. For me, Ryan does a lot of traditional braces and a lot of Invisalign. So we're a family practice. So we see whole families.
We have an oral surgeon that comes in.
Yeah, we kind of want to keep everything in house. I think we're all I want to diverge and do more big implant cases. That's kind of where I want to kind of go to, not do MO fillings, do more full arch.
You got to keep bringing on the young associates who are still willing to do that.
And then kind of deal with all the headaches that is large implant cases too. I mean, just try to make it part of the practice. So.
Let me go nerdy for a minute. What kind of implants you like using, or what are you using these days?
I've used BiHorizons for a long time. We just switched to Han recently. I might actually switch to Implant Direct. I'm not crazy about Han. I took a hybrids course recently. I don't know if you know them.
I have.
He's friends with Pete, right?
Yeah. So I've not done a case yet, but I really like what I saw. I've done some full arch Bruxer units from Glidewell, done a few of those, but the hybrids thing seems really cool, and I'm anxious to kind of use that as a springboard into more full mouth stuff.
So I mean, the stats kind of change on what people's preferences are. What do you like doing on maxillary versus mandibular? If you have an edentulous arch, or you're going to do a FUMTI full mouth tooth extraction, like what's your favorite for like implant numbers? Like let's say on upper versus lower.
You did flip nerdy. I'm in a hurry,
I'm
bro.
sorry.
We're
going to go all over.
Because he goes, we're not going to talk clinical.
Yeah.
A little
Go for it.
Well, I was mistrained, right? So I was originally mistrained.
Nice. Okay.
So I'm very. I mean, in a perfect world, if time and money were no object,
Yes.
I look at it like you do sinus lifts and you do, 8 implants on the upper would be kind of in a perfect scenario.
Yeah.
And, 6 on the lower probably.
Mhm.
Probably what I would lean towards, but realistically, it's not an easy thing to do all the time. And I think price point's a big deal. So if Highbridge gets us with doing 6 up there and keeping them forward and not having to do a sinus lift and it's predictable, I'm good with that.
Yep.
That's kind of.
Can I tip off of that? Because it's one of my favorite words. What do you do every day to make your life predictable? To make the practice predictable, the team system predictable, the clinical outcomes? What do you think about?
Practical
Because
systems.
I love the word predictable versus perfect, right?
Yeah.
I don't even want to strive for perfection because I'm often disappointed, right?
Yes.
So how do you make it predictable in your practice?
Gotcha. I think there's a whole lot of things that go into making things predictable, right?
Complex.
I completely buy into the 10,000 hour concept. I think things simply get more predictable the more practice you have, right? You know your limitations in not only what you do and how you do it, whether that's simply doing a filling the exact same way so many times, you get a comfort level with what you're doing. Simplifying the way you do a crown prep, so you know that you're doing this part first, this part second, this part third, and it's always the same. You also simplify the way you speak to people, right? I think you become, with time, you become more concise in what you say. You don't get into the verbal circle of death that we like to get into.
A little verbal vomit on your patients.
So I think
your staff's looking at you like.
I think by repeating you're saying the same things, right? And you're being consistent with your speech, and you're being consistent with your thoughts. And that
So you don't talk sheer bond strengths of adhesive choices with your
only
patients?
with you, Chad. Only with you.
Good for you.
But I think a lot of it just comes through repetition.
So did you like when you were getting started in making this predictable, did you, like, I know Jeff Buski, Bruce's partner, right? Jeff would, like we talk about the one app play at PDA, and he would write that out and put it on his steering wheel and read it on a Post-it note, as that was like his everyday thing. He'd go, okay, I want to talk to you about risk factors today. This helps us create predictable dentistry, right? And he would just drive to work saying one phrase a day until he memorized that phrase, and then it became natural, right? Because the only way you know somebody's acting is if they're a bad actor.
Yes.
Yeah, right.
Sure.
So was there any speech coaching or things like that helped you be more comfortable in that presentation?
we're PDA people, right? So we've used these principles for a long time now, but you get lax, right? So a lot of times it's as simple as Ryan saying, dude, treatment plan numbers are down. We need to get back to basics, right? I mean, like, what do we do? Like, what are we doing, right? So it's a lot of it's kind of self-policing and watching the numbers and going from there.
I did have the PDA scripting printed out and taped to the wall.
That's cool.
Like in your office or in
above my computer.
Yeah.
And everybody takes it back, and I bet if we just said, what is that script, you guys would have 3 variations of that script.
Yeah, sure.
Mm-hmm.
Right, so that's the beauty of it.
Yeah.
You're not robotic like a Delta flight attendant.
Exactly. Yeah.
But what are the big keys things that like really help patients walk down the path of self-realization, right? Like, oh, I do have this challenge, and this is the best place for me to get this work done.
So kind of what's your spiel after you've done your
like you
findings
got to
and
do
your-
the risk factors, and then what else is important in that from a doctor's perspective?
Trying to make them feel comfortable there. We have a great team. So when I see a patient, that patient's already has a favorable look at the office. So it makes it a little easier to kind of convince them that what they need. They trust me.
Yes.
They have more trust because they have a favorable opinion of the whole office in their journey so far. By the time I meet them, they've already met our hygienist. A lot of our new patients come in through that side.
We are
different there. Yeah, we are different there. So
better or worse.
Because it's been working for us. So so that's part of it. And then it's just kind of, we use the typical script we all have variations of it, but very,
4 months,
4 months, 4 years, 10
stuff like 10 different opinions. Does that make sense?
Exactly. I mean, just kind of the little,
absolutely.
the little things.
And I think one of our,
ballpark.
I don't.
Rarely.
That's something we need
I'm
to work
starting
on.
to try to
Something we
do
need to
that.
work
Do
on.
you know, Ryan?
I don't
honestly,
do that all
I
the
don't
time.
either. And the reason why is like I always broach the subject. I say, before you leave, we'll get you a cost estimate. And they'll say, what are you thinking? I'll be like, I'm just so all over the place with it. I don't know. Like right now, my hygienist is adding it up, and she'll get. Before you leave, we'll get you a ballpark, and then also if there's insurance to factor in, all that stuff. But I'm really bad at, because they'll say, why don't you overestimate then? And I'll be like, okay, it's like $1,000 for a crown. They're like, no, that's not overestimating. And I'll be like, okay, like $2,000 for a crown. And then they say, no, that's way too much.
Yes.
And I'm like, well, then why don't I just do the exact number then? I just forget.
And I've never really put forth the effort to make that happen.
No.
Right? I'm with you. It can be something that's kind of uncomfortable for me.
And to each their own. If someone
and-
can do it, that's
Yeah.
great. I just never have been the best at doing that. And at least I acknowledge that. And so I kind of just give it up rather than being wrong.
Yeah, I'm completely with you though. If you ask me to estimate, I'd want to make them like
Happy.
I want to be like, man,
They'll probably
that's going to be a great deal. Let me tell you.
40,000. I'm like,
Yeah, absolutely, right?
Yeah, when
Absolutely.
you're ballparking and you're horrible at it, don't ballpark.
Yes, don't
Yeah.
ballpark. Yes, and know thyself. So
Yes.
if you're not good at it,
Funny story about scripts and repetition though. We always do follow-up calls, right? And kind of our rule of thumb is that at night, basically anybody we numb up, right?
The
We call to
doctors.
check
Good
on.
for
Yeah, the
you.
doctors do it
Wow.
personally.
Nice.
Go
We
to
all do
my
that. We've
PC,
done
log
that.
in.
That's
done
an
that for-
everyday practice.
Yeah,
right
we've
there.
done
I
that
love
for years.
I mean,
I learned it from a dentist that I met when I was in dental school. That was my wife's dentist growing up. And I learned that from him as being a positive thing. I think it's one of the most positive things that you can do from a really showing that you care about the patient. You're taking time that's not work time. I think it really mitigates any kind of
Questions,
issues with
yes.
patients. I mean,
Right.
it's
handle the objection.
a
before it
really,
becomes
really
objection.
strong
They don't get to
bond.
stew on it for 2 more days
Yeah.
before they come back to see you that their bite's off.
Yeah.
You say, oh, your bite feels a little high. Okay, call off. We'll get you in tomorrow, and it just helps.
And I had a guy one time, he was in his 90s, and he told me, I've been on earth almost 100 years, and you're the only doctor of any kind that has called to check on me, which is really cool. But my point of that is I make those calls every single night, and I say the exact same thing, and I will see my 10-year-old daughter mouthing,
The
hi, this,
words.
like if I
Yes.
have to leave a voicemail, I'm like, hi, this is Ryan Oakley, the dentist. I was just calling to check on you. I hope everything's feeling great. If you have any questions or if you need something, give me a call. My number is, and I'll see my 10-year-old mouthing it because she's heard me say that every night for years.
Yes.
And she knows my script.
until
by heart.
someday she might say, this is Dr. Oakley.
Yeah, right.
Oh,
Yeah.
ooh, good
Yeah.
point.
I think that's so
You got to
cool
meet
'cause
Harper.
to be transparent with the listeners, I don't do that. but occasionally I do. And when I do it, it goes off. Like, I don't know why that doesn't give me enough positive reinforcement that I go, wow, I should do that tomorrow. But when I do it, they go, that is so sweet of you.
Oh, yeah.
And then have you noticed they do like the 2-minute ramble? So yesterday I was noticing that it kind of hurt, and then it didn't hurt, then I noticed it was like sore, but like today it's way better. And then it's just so nice of you to call. And yesterday I had the greatest time there, and the receptionist was really nice. And yeah, it's a little sore, and they make the circular kind of thing, and then they go, okay, thanks.
Yeah.
And it's just done.
Yeah.
Right.
It is
great.
It is so positive.
Yes.
And I would highly recommend that to anybody. And I bet if I timed it, and I bet if you timed it,
That's what I want to know. Half hour?
No,
God,
not
5
even.
minutes.
10, maybe 10
5 minutes.
Maybe
For
10.
all of your patients?
Yes.
No, only patients that
That you
only
know
patients
about.
that you know
So,
about.
yeah.
That's kind of our cutoff rule. I know. I did this one time. I had this old lady, and she really was a doll. But when I first started out, I was calling everybody for everything, and
Yes.
I called this. I don't know if I just like adjusted
An
something
alternate
for her or whatever.
impression, yeah.
But I called this old lady up. She's like, "What are you calling me for? We didn't do brain surgery." And I was like, "All right, so maybe I need to maybe I need to only call people that I actually did something on." But no, we that's kind of my cutoff. My rule is people that I numbed up. That's kind of how
Or
you
it's
do
like
it
a
too.
big, if it's a dramatic thing, like let's say you delivered a denture that you've been
Right.
having troubles with, and you just want to check on. I mean,
Yeah.
I mean, it shows you care. I have patients now they'll say, I'll do something on them and say, now don't you take time away from your family to call me tonight. All right, I'll call you. Because they know I'm going to call.
Yeah.
Or they'll answer like, hey, I'm
Yeah.
expecting your call. Yeah,
Absolutely.
I mean, they get it.
Or
They've
the
been doing it
wife
for
will
years.
pick up. You're calling to check on the husband, and the wife will pick up, and you'll check on him or ask to speak to him, and you'll hear her go, "I told you he was going to call you tonight."
Yes, exactly.
And so like it
Yeah,
builds
it's
builds a
huge,
super
huge.
bond, and really it takes 5 to 10 minutes. At least 50% of the time you get voicemail. It really is quick.
And they'll
And
just
it
text
is.
you back, thanks for checking on me,
Yes.
blah, 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 if you get the voicemail.
And if we had to list out like what things do we do to create a positive experience every day,
Yeah.
I would say run on time and make the follow-up calls are way at the top of the list.
Yeah.
Very cool.
Man, that's a wrap.
Yep. Thanks, listeners.
That's it?
No. Well,
We're
we
gonna keep going.
started out meandering on this, purely social image thing, but this level of detail and commitment that you guys have in your personal life, you see that flows through to the practice. Like
Sure.
you're not putting it on the team. All right, you guys do this, you guys do
Yes.
that. It's like you own it as clinicians, you own it as owners, and you own it just as great human beings on this planet. And I'm guessing that your referral rate is pretty high.
We can get the exact quote from Jenny, but yeah, I think we hover between 55 and 60% of our new patient numbers are from internal
Which
referral.
is a perfect target, 50%.
Yeah, and Jenny kind of harps on us because we don't have a real system. We track it. We send them a thank you card with, you can get Amazon gift cards with like your
Right.
logo put on them, which is kind of sweet.
Oh, no kidding. Well,
we
that's
send,
another
we
good
send
referral.
people a $20 Amazon gift card and a thank you card when they refer somebody, and that's all we do. But it's not like we don't
retro.
we don't even necessarily ask for referrals. We could
That's
probably
great,
get
though.
better at
That's
that.
okay.
For
But,
most of the states, you are very much in compliance.
Yeah,
Right?
Right.
So I like that.
yeah.
And how many new patients per month do you see?
105 is our average right now. 105 right now is our average for 2018.
And like 55 a month are coming
Yeah,
from
yeah,
referrals.
50, yeah.
Just
So I
55.
want to get
yeah.
some context around this because, people say, oh yeah, half my patients are coming for referrals. Well, how many patients do you
Yeah,
see a month?
If that's six.
Six.
Yeah.
Right? I got 3 and they were like one family.
Yeah.
And then I got the other 3.
We consistently get 50 a month from internal referrals.
So I think that's
more.
really important because you are a high volume practice,
Mm-hmm.
you are a high quality practice, and the doctors take the time to call the patients. That's my everyday practice right there.
Yes.
Ryan, thank you so much
No
for
problem.
joining
Good.
us today. This has been really fun.
That's awesome.
You're going to ask them the question?
Oh, geez, I have a lot more, but I don't know
Ask
if we should
the
go into overtime.
question.
Oh, all right. I want to know,
Uh-oh.
guys. We've got
The
yeah,
question.
the
The
question.
question.
Bacon or eggs? You got to choose one,
Eggs.
and you can't explain.
Bacon.
Ooh, what?
Bacon?
Everyone says bacon.
Eggs.
Everyone
Eggs.
says
Except
bacon.
for Ryan.
Way to go. Way to be a
Bacon
outlier.
and egg.
See, and you-
Following the massive.
I am.
All right. Chad, that's a wrap for me. How are you doing?
Yeah, listeners, thanks for listening in. Take care.
Bring your lunch or take us to the gym again next week to improve your everyday practices. Also, subscribe on iTunes, follow us on social media, and sign up for our email list. Now get out there and win with everyday practices.